Hi, and welcome to Back in Action. Part one of Back in Action. This is going to be a five-part series intended to use as a resource available for anyone who needs it to understand lower back pain. But not only understand lower back pain, I'm hoping this can be a tool and a resource available for people to manage lower back pain and prevent it from happening in the first place. I'm going to provide you videos of exercises and stretches and offer advice and recommendations for management, treatment, and prevention of lower back pain. I am going to dive deep into the weeds, but before we do that, I'd like to introduce you to myself and tell you a little bit of why I'm so passionate about this subject. My name is Justin Drain. I am a certified and licensed athletic trainer, ATC. I'm also a health coach, a certified health coach. My background is in sports medicine. I started my career as the director of sports medicine at a K through 12 private school on Oahu in Hawaii, where I was solely responsible for the health of K through 12 student athletes. My primary responsibility was to evaluate and treat injuries, but I was also involved in preventing injuries from happening in the first place. And I saw a wide variety of injuries and health conditions and all types of things that I helped student athletes manage and ultimately prevent. After a few years as the director of sports medicine, I decided to transition into occupational health, where I took a job as an occupational health specialist in an occupational health clinic working in the transportation industry in Western Washington. There, I had similar job responsibilities. I was evaluating and treating injuries to anyone who worked in the industry, which included, bus drivers, mechanics, administrators. Evaluating and treating injuries was the primary role of that job. I also spent a lot of time doing preventative services, giving safety talks and presentations and ergonomics coaching, which we're going to talk about later in the series, and overall helped make the workforce of the transportation industry healthier. What started my interest in this subject was the most common thing that I saw was lower back pain and injuries of all kinds. I learned in my time in occupational health that lower back injuries are unbelievably common. They can be very debilitating, not only physically, but also, socially and economically for individuals, for corporations, at any level, even at the nationwide level. Lower back pain is often really misunderstood. And what also comes with that is commonly mismanaged, not only by individuals, but sometimes even by the providers that they go and see to help them manage it. So I'm intending this series to be used as a resource to help with that. As mentioned, this is a 5-part series. This is part 1 of the series where I'm going to help you understand the causes of lower back pain. We're going to go through, the symptoms, we're going to go through the risk factors, the types of lower back pain, common causes of it, and I think understanding all of these things is going to really help, set a standard for understanding it and, beginning the process of preventing, treating and managing lower back pain. I think understanding these things is very important. But then the fun part comes. In part 2 through 5, we're going to get into the weeds of, what to do about lower back pain. Part 2 is going to be when to seek professional help and what types of providers you should go see, depending on what kind of lower back pain and what kind of symptoms that you're experiencing. Part 3 is going to be a lot of fun. It's what I'm most excited for. I'm going to offer stretches and exercises for relief of lower back pain. I'm going to provide videos and demonstrations and photos and explanations of some different things you can do to hopefully make your lower back feel better. Part 4, we're going to talk about the role of posture and ergonomics. And in part 5, we're going to talk about lifestyle changes you can make for long-term health of your lower back. That's going to really be where we really dive into prevention and things that you can do at any stage of your life to help your lower back feel good and be injury-free. So with that being said, let's get right into part 1. And I think it's really important to understand that you are not alone. Lower back injuries and pain is actually the leading cause of disability worldwide. In 1 year alone, 619 million people experience lower back pain. It is a severe economic strain. It's, as I said, the leading cause of disability worldwide. Many people deal with lower back pain. A lot of people work through it, and some people, it completely, upends their entire life. So whether it's a dull ache after a long day or a sudden pain, understanding the cause of your discomfort is really the first step towards finding relief. In this first part of the series, I'm going to explore symptoms, risk factors, the most common causes of lower back pain. One thing that I do highly recommend is reading through the blog post that I provided in part 1. It could be really helpful to actually follow along with that blog post as you watch this video, listen to the podcast, and go through. I provided kind of a surface level, basic understanding of these ideas in the blog post, and I'm going to dive a little bit deeper into the weeds here in this discussion. So let's start with symptoms. It really varies in intensity and duration. There's tons of different types of lower back pain. There's tons of different causes of lower back pain, and we'll get into a little bit more of those later. Some symptoms are mild and temporary. Some may be severe and persistent, requiring medical attention. But overall, the most common symptoms are like a dull, aching pain across your lower back, or maybe it's in one specific spot. Maybe it's in one specific side. If you're experiencing those, try to note the specificity of it. Whether it's, dull or achy, where exactly you're feeling it. Is it sharp or stabbing pain? Does it radiate? Does it travel down your legs or into your thighs, or maybe even all the way down to your foot? Does it feel like burning or stinging? Do you simply just have some stiffness and reduced mobility? Are there any certain activities that increase or worsen your lower back pain? Or you may even experiencing muscle spasms. I encourage anyone who's experiencing lower back pain to try to take note of these symptoms, especially if you're going to go seek medical care. Try to be as specific with your symptoms, where you're feeling it, what type of discomfort that you're having, because they're going to ask you that in your initial evaluation to try to understand the root cause of it. So it's important to try to note those things, and that may change minute by minute, day by day, week by week. So keeping a log of your symptoms could be very valuable. Next, I want to talk a little bit about the risk factors of lower back pain. All in all, lower back pain can affect anyone of any age, with any type of lifestyle, at any time. There are some things that can make you more prone to lower back pain. Like I said, I've seen lower back pain in youth athletes that are, 10 years old soccer athletes. I've seen lower back pain in super fit, high-level college athletes, high school athletes. But then it just kind of gets more and more common as you age. Starting around 30 or 40 years old, lower back pain incidence starts to go up, and then it continues to go up as you age. As you age, you lose hydration and elasticity of the discs that sit between your spine, and that can lead to pain from degenerative disc disease, arthritis, or spinal stenosis, and those things are things that we're going to go through in a little bit more detail a bit later. And due to these age-related changes, older adults are much more likely to experience what's called chronic lower back pain. We'll talk about that as well. Also, lack of regular movement. That really weakens the core muscles that support the spine and leads to poor posture and increased stress on the lower back. So sitting for extended periods, especially with bad posture, can put excessive pressure on the spine and contribute to stiffness and ultimately pain. Carrying excess weight, especially in the abdominal area, can also place extra stress on the spine. It shifts your center of gravity and increases pressure on the lower back. This can lead to, faster degeneration of spinal discs and chronic pain, which we'll talk about here soon as well. Lifting heavy objects improperly, or sudden movements, or even repetitive, overuse of, small lifts that are affecting lower back can strain the muscles and ligaments in your lower back. This type of pain often occurs after intense physical activity, like lifting weights or performing repetitive movements, like say you work on a line at a factory and you're twisting and turning and lifting small things all day, and you're not using proper form. Strains and sprains can cause inflammation, stiffness, and reduced mobility, and all of those things can lead to discomfort. So your core muscles play a crucial role in stabilizing your spine, and if these muscles are weak, the lower back takes on more stress, leading to pain and discomfort. Lack of strength in the core makes it much harder to maintain good posture and absorb shock from daily movements. Okay, so it's important to have a strong core, and as you age, things get a little bit more challenging for the lower back. Let's talk about a little bit of the basics of types of lower back pain. I would say there's kind of two major overarching categories of lower back pain, and understanding these can be very helpful. There's acute lower back pain, and that usually lasts, less than 6 weeks. It's often triggered by like a sudden injury. So if I were to go lift something off the floor right now, I have a fat cat, she's pretty hefty. If I lift her off the floor real quick and I feel a pop in my lower back, that's an acute injury. It's like, oh man, it happened and I'm noticing it. And generally it's 6 weeks or less. It usually resolves with rest, but often requires proper care and mild treatment to keep it from progressing to the other type of lower back pain, which is chronic low back pain. Chronic low back pain is long-term, 12 weeks or longer, even after the initial injury even healed. If you're still experiencing injury, it might be from underlying conditions like a degenerative disc disease, arthritis, or nerve compression. Unlike acute pain, chronic low back pain often requires, long-term management. It is, very helpful to seek medical care, and that can include lifestyle adjustments, physical therapy, or even further medical interventions to improve function and reduce discomfort. So let's talk a little bit about the most common causes of lower back pain, and I'm gonna, divide these into three main categories. And those three main categories I'm going to say are, mechanical or structural problems, or number 2, inflammatory conditions, or number 3, other medical conditions. So mechanical and structural problems are those, sprains and strains from, a lift, like lifting a hefty object. Mechanical could also be degenerative disc disease, which happens with age, or if you have some of those other pre-existing conditions, or if you have some of those other risk factors, you're more likely to experience degenerative disc disease. Can also be like herniated or ruptured discs. Those are generally more acute injuries that happen from an instance, but could also be chronic in nature from repetitive overuse. Fractured vertebrae happen. Spinal stenosis is a narrowing of the vessels that lead to the spine, and can cause compression and discomfort there. Alignment issues like scoliosis, or what we call spondies, which are where one of the facets, the bony segments in between the spine, when one of those shifts out of place, or fractures, we call those a spondee. That's a big word. And then there's also myofascial pain, where it's like soft tissue restriction that causes discomfort. There's also, inflammatory conditions that can cause lower back pain, like arthritis, or even inflammatory bowel disease. Often the inflammation of the bowels triggers pain in the lower back. There's also plenty of other medical conditions that can lead to lower back pain. That could be osteoporosis, which is like a weakening of the bones, and that increases risk of those fractures or those spondies that we talk about. Arthritis, inflammation of the spine's joints, and that can lead to stiffness and discomfort. There's fibromyalgia, a medical condition, kidney stones, endometriosis, infections, pregnancy. Those can all trigger pain in the lower back. Then there's sciatica. That's compression of the sciatic nerve, and that causes that pain that radiates down the legs from the lower back. I know that that was a lot of information, but I do think that understanding the symptoms, the risk factors, the types of lower back pain and causes is a really important first step into fighting lower back pain. As we look ahead to part 2, we're going to discuss when it's important to see a medical provider and what type of provider to look for based on, the things that we talked about today, the type of lower back pain that you have, the symptoms that you have. Is it acute or chronic in nature? And we're going to talk about the beginning of medical care. Before then, we get into the fun part and start doing some stretches and start doing some exercises for managing and preventing lower back pain. So I look forward to working through this 5-part series with you guys, and feel free to shoot me a message if you have any questions. Thanks.